All right, so in the next 3 minutes, this will be a crash course on a new decision support tool that's rolling out at St. Michael's Hospital. I think St. Mike's is really uniquely positioned to have something like this rolled out, thanks to Mohammed Mamdani and his team. So let's jump in. Here's the clinical and quality improvement team. As you'll see, a pretty amazing group of individuals. Next up, we know that patients are at high risk of having a critically low hemoglobin. How come? Well, patients get frequent blood work. Most of them don't need it. We also know that the vast majority of patients are on blood thinners, but the evidence to support that isn't great. The individuals we care for are often older adults who might already have anemia or be at high risk of it. And finally, our patient population are on multiple medications, including things like aspirin, clopidogrel, which can put them at higher risk of bleeding. I think, as most of us will know who work on the inpatient unit, once a hemoglobin level approaches 70, alarm bells go off. At that point in time, we often think this person needs a blood transfusion. We sometimes order even more blood work to find out why is their hemoglobin critically low. And they can go on to get procedures like gastroscopy and other imaging to determine why are they bleeding or why are they apparently bleeding. Our team asked the question of whether or not alerting at a higher level might potentially prevent this cascade of tests. And at this higher level, maybe we can pause and think, geez, maybe we can hold the DVT prophylaxis. Maybe they don't even need it anymore. Maybe they're on a blood thinning medication, which we could hold for a brief period of time while we've ruled out that they aren't bleeding. Or maybe they're iron deficient and need some intravenous iron. And it gives us an opportunity to review their blood work and ask, geez, do they really need this daily blood work? So what we've developed, it will be an email alert for high-risk patients. We're flagging high-risk patients based on those with a hemoglobin less than 86, a fall in hemoglobin of 30 points or more, or a platelet count less than 50. Each team will get an email alert. On average, it should only be about one patient per day. Sometimes there'll be no patients. But here's what it'll look like. Very quickly, you'll see which patient is it, their MRN, what is their current hemoglobin, what was it initially, what was their current platelet count, what was it initially, and are they on an anticoagulant? We tried to focus on patient-centered outcomes, and let's talk through some of them. So certainly the rate of blood transfusions. Who knows, maybe with this early alert, we can reduce the number of blood transfusions that our patients receive. Hopefully we can alert these critically low hemoglobin and their associated cascade of tests that occur thereafter. Hopefully it asks and gives us a chance to think about, does this patient still need to be on full dose anticoagulant, or perhaps we need to hold that for a few days. There's also other measures as well as counterbalancing measures. I hope this has been helpful. We're very excited for this project to launch. It will be launching in August of 2023. And hopefully we'll be able to prevent these critically low hemoglobin values for the patients we care for on the general medical ward. Thanks so much. Leave any comments or questions below.